Welcome to Key Terminology, Chapter 6 of your HHA training course, Module 1. As you enter the home care field, you'll encounter specific terms used daily by healthcare professionals. Understanding this common language is essential for clear communication, ensuring patient safety, and performing your role effectively. This chapter will define these important terms and provide examples to help you remember them. Let's get started. Let's go through the key terms you'll use regularly as a home health aide. First, ADLs. This stands for Activities of Daily Living. These are the basic personal care tasks someone performs every day. Think of things like bathing, dressing, grooming, and eating. For example, if your client, Mr. Jones, needs help getting dressed in the morning, that's an ADL you'll assist with. Next, IADLs. These are instrumental activities of daily living. These tasks are important for independent living but aren't as basic as ADLs. They include things like cooking, light cleaning, and shopping. For instance, if you help Mrs. Davis prepare her lunch or do a load of her laundry, you're assisting with IADLs. The care plan is a vital document. It's written instructions created by a nurse outlining the patient's specific needs and your tasks as an HHA. It's your roadmap. For example, your client, Mr. Lee's care plan might specify he needs assistance with bathing 3 times a week, or that you should encourage him to walk with his walker for 15 minutes daily. Always refer to the care plan to know exactly what care to provide. Confidentiality is about protecting your client's private information, which is also safeguarded by HIPAA law. This means you never share details about your client's health, their family, or their home life with anyone outside the authorized care team. For instance, you wouldn't discuss details of Mrs. Chen's medical condition with a neighbor or a friend. Their privacy is paramount. Observation means watching and noticing changes in a client's condition. This is a critical part of your role. For example, if Mr. Garcia, who usually finishes his meals, suddenly starts eating very little and seems more tired, your observation skills recognize this change. You'd then report it to your supervisor, as it could indicate a new health issue. Documentation is the act of recording the services you provide and your observations in the client's notes. This creates a clear record of care. For example, after your visit, you'll document that you assisted Mr. Singh with his bath, prepared his breakfast, and noted that he complained of mild ankle swelling. Accurate documentation is crucial for communication among the care team. A client is considered homebound if they are unable to leave home without significant help due to health reasons. This doesn't mean they can never leave, but it's difficult and requires assistance. For example, a client who can only leave their home for medical appointments or infrequent, short outings with great effort would be considered homebound. Respite Care provides temporary relief for a client's primary family caregiver. Families who care for loved ones often need breaks. For instance, you might provide care for Mrs. Adams for a few hours so her daughter can attend an appointment or get some rest. Your service gives the family caregiver a much-needed break. Personal care refers to assistance with hygiene and grooming tasks. This directly relates to ADLs. For example, helping a client brush their teeth, comb their hair, or apply lotion are all part of providing personal care. It's about helping them maintain cleanliness and a sense of well-being. Finally, skilled care involves services provided by licensed healthcare professionals like registered nurses, RNs, physical therapists, PTs, or occupational therapists, OTs. For example, changing a complex wound dressing or administering an injection would be skilled care provided by a nurse, not an HHA. Your role would be to assist the skilled professional or observe and report within your scope. Understanding these key terms is fundamental to your success as a home health aide. You now have a clear grasp of ADLs, IADLs, care plans, confidentiality, observation, documentation, homebound, respite care, personal care, and skilled care. Using these terms correctly will ensure you communicate effectively with your care team and provide the best possible care to your clients. Keep reviewing them, and you'll become fluent in the language of home care. Thank you for your commitment to learning these essential concepts.